Welcome to Brain eCourse. In this short video snippet, we are talking about some confusing terms related to tolerance. Tolerance is the diminution of the drug effect, typically after repeated administration. It leads to shifting of the drug response curve to the right. This is also called surmountable tolerance and can be overcome by increasing the dosage of the drug. Sometimes insurmountable tolerance can develop, wherein there is a downward shift in drug response curve, and this is not sensitive to dose adjustment. One of the best examples to understand tolerance could be looking up at development of tolerance in alcohol consumers. Tolerance to alcohol can be of two main types: acute tolerance, chronic tolerance. There is another important tolerance which can develop called learned tolerance. Acute tolerance happens during the phase of raising blood alcohol concentration in a single administration. Hence, they end up drinking larger amounts of alcohol without much of effect of the substance. Chronic tolerance develops following repeated administration over a period of time. This can happen mainly due to pharmacokinetic tolerance, pharmacodynamic tolerance. The other name for pharmacokinetic tolerance is metabolic tolerance. Pharmacodynamic tolerance is also called molecular, cellular, or functional tolerance. Pharmacokinetic tolerance or metabolic tolerance is one which develops secondary to pharmacokinetic changes, secondary to repeated drug administration. These changes could include faster absorption, higher metabolism, or quicker elimination. These actions truncate the effect of the substance or the drug. With respect to alcohol, the changes commonly noticed is the raised ADH activity, but this is not a mainstream mechanism as this is rate limited by the availability of the coenzyme NAD. The main mechanism is possible activation of hepatic CYP2E1 enzyme leading to development of metabolic tolerance. It takes days to weeks for this nature of tolerance to develop, but it can be reversed after 3 weeks of abstinence from alcohol. Pharmacodynamic tolerance to alcohol can develop secondary to changes in the receptors, second messengers, and neurotransmitters. This takes few days to weeks to develop. All these changes makes the target organ less responsive to the effect of alcohol. Now coming on to learned tolerance, it can be of two main types called behavioral tolerance and conditioned tolerance. The classical conditioning and association plays a role in learned tolerance. There are behaviors which are expected to change in intoxicated individuals. Some of them are learned. In behavioral tolerance, there is diminution of this learned goal-directed behavior following use of drug or substance. In simple terms, the intoxicated person behaves less drunk and more stable. Behavioral tolerance can appear and disappear very rapidly. Conditioned tolerance happens following repeated drug or substance use leading to association of paraphernalia and as well environmental cues. This can cause one to develop tolerance in similar circumstances. For example, a cocaine user repeatedly goes to the same spot in the housing complex to administer cocaine every day. On a particular day when he is sober but in the vicinity of the same spot, he might develop compensatory bradycardia due to conditioned tolerance. There are two other terms which are important to be remembered, namely tachyphylaxis and reverse tolerance. Tachyphylaxis is the sudden onset of tolerance or rapid diminution of effect with no relation to either dosage nor repeated administration. Reverse tolerance is nothing but excessive sensitization, wherein the opposite of tolerance happens. It is characterized by intoxication or higher effects at lower dosages of intake of the drug or the substance. Hope you learned some crucial differences in various types of tolerance. Go to any one of the links mentioned here to get further updates. Do subscribe to this channel for further updates in relation to various aspects of mental health.